Hello, I am Dr. Sapkal here. The title for discussion today is Alcohol, Tobacco and Drug Addiction in Pregnancy. Wide variety of drugs are abused during pregnancy. Hence, documentation and concern about its use should start in preconception period itself. Neonatal withdrawal symptoms are reported with alcohol, heroin, methadone, opioids addiction in pregnancy. Teratogenic effect is seen with the drugs which are used usually during the period of embryogenesis. Let us see what is the effect of alcohol use in pregnancy on the fetus. Excess alcohol consumption during the period of organogenesis can result in fetal alcohol spectrum disorder FASD. Chronic alcoholic women, 1/3 of them can develop this fetal alcohol syndrome or fetal alcohol spectrum disorder. Full-grown features are not seen in all cases. There are 4 key diagnostic features of this fetal alcohol spectrum disorder, and there should be at least 3 to confirm the diagnosis. First one, of course, gestational alcohol exposure should be there. Then, features of fetal alcohol facial phenotypes in the newborn, evidence should be there. As about the central nervous system damage, mental retardation and microcephaly may be there. Last feature is growth restriction and delayed psychomotor development in the child. In this fetal alcohol syndrome, there is usually midface abnormality or hypoplasia of the midface. All these features they are detected after the 2 years of age in the child. In these cases, there is beaking of the forehead, microganthia means mandible is small, low set ears, nose will have shrunken bridge with short nose or small upturned nose may be there. Then the upper lip is usually thin with indistinct philtrum. Sometimes cleft lip, cleft palate is also seen. Ocular malformations are also documented. Epicanthic folds, short palpebral fissures are seen in these cases. Lastly, renal malformations are also documented in these cases. Irritability, poor postnatal somatic growth is a typical feature in these cases. Thus, with poor muscle tones, there is risk of sudden neonatal death in the cases of fetal alcohol syndrome newborn. Let us see the effect of tobacco use in pregnancy. Tobacco may be used in the form of chewing or snuff, or it may be used in the form of smoking, where it can be an active smoking or a passive smoking. As such, 25% of the women in the developed country they smoke. What are the complications in the smokers? Carbon monoxide and nicotine, they are liberated from the tobacco. They cause impaired uterine artery blood perfusion and result into structural placental changes, which can land up into abortion, IUGR, accidental hemorrhage, chorioamnionitis, premature rupture of membranes, and even placenta previa. One advantage is also there of tobacco use, that it prevents preeclampsia. With the passive smoking, in 60% of the fetus there can be risk, and this risk is dose dependent. There is chance of decrease in fetal weight. Sudden infant death syndrome is observed in the patients who are addicted to tobacco use. And no specific congenital defects are documented in these cases. Increased fetal erythropoiesis and increase in levels of carboxyhemoglobin is seen in the neonate. Hyperactivity is usually observed by the age of 4 years. The children are usually small stature with mental deficiency. With the use of cocaine or heroin, in these cases, heroin and this methadone, they are the narcotics which are frequently abused in pregnancy. They result into preterm birth, intrauterine growth restriction, hypertension, and accidental hemorrhage. Let us see what is the effect of this cocaine or heroin on the fetus and what are the defects. Genitourinary defects are the common defects. Among them, hydronephrosis, undescended testis is usually seen. Late ossification of long bones and limb reduction defects are also documented, and sometimes eye anomalies are seen. As regards the CNS anomalies, exencephaly, microcephaly, and sometimes there is a risk of cerebral infarction due to its vasoconstrictor effect, and there is a chance of periventricular leukomalacia. Perinatal cocaine intoxication is seen in 70% of the neonate, and these cocaine withdrawal symptoms are seen within 48 hours to 72 hours after childbirth. Tachycardia and fever, vomiting, diarrhea, jitteriness, tremulousness, and hypertonia is seen in these cases. Opioids use can cause IUGR and stillbirth. Hence, pregnant women must be advised against the use of alcohol, tobacco, and other drugs like cocaine, opioids in pregnancy. Thus, we are taking care of both fetus and a mother in pregnancy when the lady avoids the use of these drugs addiction in pregnancy. Thanks for watching this video.